Hi, everybody. I'm here with Dr. Natasha Hamid, and I'm Dr. Asaf Harel, and we are neurologists specializing in the care of people with MS and related conditions at the Northwell Comprehensive MS Center. We're here to talk to you about commonly asked questions, questions that people with MS usually ask us in the clinic. Understanding multiple sclerosis through question and answer, it's very, very, very important for people with MS, patients with MS, to ask questions, to be fully informed. And so we feel like this is a good way to learn a lot about this condition. So Natasha, a lot of patients who have a new diagnosis of MS often ask, what is MS? Can you help us understand that a little bit more?
Yeah, sure. So what is multiple sclerosis? So of course, that's, the big question patients have when they come in to see us at the visits. What is multiple sclerosis? So definitely one of the most important topics and questions that you want answered during your initial visit. So what is multiple sclerosis? Multiple sclerosis is an autoimmune inflammatory disease of the brain and spinal cord. So what do we mean by an autoimmune disease? So an autoimmune disorder is a disease where your body's own immune system, which is your natural defense system, where they're the cells, your immune cells in your body, are supposed to protect your body from anything foreign, for example, infections, bacteria or viruses. But what happens in an autoimmune disorder, the body makes mistakes. The immune system makes mistakes, and it cannot differentiate between what is a healthy cell and what is a foreign cell. So autoimmune disorders can affect several different organs of the body. And we'll just kind of go over a few for an example. So I like to simplify a few things for the patient. So, think of it this way. Believe every organ of your body carries an identity card with your name on it. So knowing that that's part of your body, that's your own healthy cells or your own healthy organs. What happens in autoimmune disorders, certain organs of our body lose their identity card. For example, the skin, say the skin loses its identity card, the skin becomes vulnerable. It, is exposed to the immune system. The immune system no longer recognizes it as self, and it leads to a autoimmune skin disorder, which we call psoriasis. For example, if your joints and your body lose their identity card, they can cause an immune attack and lead to an autoimmune joint disease, which is called rheumatoid arthritis. And then lastly, for example, the thyroid gland, if that loses its identity card, that can lead to an immune attack, which can lead to an autoimmune thyroid disease, which is called Hashimoto's thyroiditis. So same as the case in multiple sclerosis, in where we have the brain and the spinal cord, they're losing their identity card, and it's leading to multiple sclerosis. So what happens during this immune attack? We have cells in the immune system. We have our B cells and T cells. What they do is basically they work together to attack the nervous system. And when they're attacking the nervous system, they're causing destruction of the insulating or protective layer around the cells, which we call the myelin sheet. And the role of the myelin sheet and why it's important in our nervous system is that it allows for the electrical signals to kind of efficiently and really quickly pass from point A to point B. So if you think of it, if there's any interruption in the signal, it can affect how signals run through our brain, run through our spinal cord, and then can eventually lead to physical manifestations that we know as MS symptoms.
That was very interesting. Another question that a lot of patients ask me is, I have this new diagnosis. There's a lot of uncertainties. What should I expect? What symptoms can MS cause?
Sure. So the symptoms in MS actually arise from, like we just talked about, that immune-mediated injury, which can occur to the brain, the spinal cord, and usually it's where in the brain or spinal cord that injury happens can kind of lead to a particular physical symptom manifestation. So what the injury does is disrupts the electrical communication between the brain and the rest of the body. It can cause a whole host of, clinical symptoms and signs. And the symptoms could either be temporary or they could even, have long-lasting symptoms. So just to kind of go over a few of the symptoms that we can come across. So for example, loss of vision. So the loss of vision could be usually one eye, and we call it optic neuritis, where you could have blurring of vision or it could be complete loss of vision. And it's usually associated with pain with eye movements. And sometimes this could be your first clinical presentation of multiple sclerosis. Other visual disturbances, you could have double vision. You can see two objects at the same time. Usually it's from the eyes not being aligned and the signals not going to the same or not being processed correctly in the brain. So you see two of one object. Vertigo, which is basically dizziness, where there's room spinning sensation. Speech changes. Patients can have trouble talking as far as like slurring of their words. Weakness and numbness seems to be a big presentation. It could be on, one side of the face, one part of the body as in form of your arm or leg, or it could be traveling up from your feet up to your upper portion of your body. Tremors, which is basically shakes of your arms. So the difficulty walking in MS could be, there could be the limitation from the weakness, or could be more of a balance difficulty that patients can present with. Bowel and bladder problems. Though invisible symptom can be very disabling at the same time. So common bladder symptoms patients really report are like frequent urination, peeing, going to the bathroom frequently, waking up at night several times to urinate, and having an urgency. So they have trouble controlling the bladder. So when they have to go to the bathroom, they almost have to rush over to the bathroom. They could have sexual problems and, other common invisible symptoms that we hear about. And again, could be really disabling: fatigue, cognitive fog, depression, anxiety, and pain. And pain can be in a lot of forms. It could be in the form of, just tingling, pins and needles pain in a portion of their body, or in the form of like muscle cramps, like spasticity as well.
Another question that MS, that people with MS ask me a lot: what type of MS do I have?
So there are three big subtypes of multiple sclerosis. We'll just kind of go over three of them. So the most common type or common subtype of MS is the relapsing multiple sclerosis. And basically we have patients that go through relapses. So relapses, attacks, flares, exacerbations, it pretty much all mean the same thing. But what we mean by a relapse is a patient experiencing a new neurological symptom, like we just went over a couple of the symptoms that patients can experience. But typically the symptoms last more than 24 hours and can eventually last on for several weeks to months, and they could get complete recovery back to their baseline, or they may be left with some residual deficits and partial recovery of their symptoms. A portion of these patients, a certain percentage of patients with relapsing MS can transition into what we call secondary progressive MS, is where they start off as a relapsing course and then eventually develop slow disability over time. And this, disability accumulation is actually independent of relapses. So, as you can see, the later part of the graph, you see the steady incline where you don't really see much, relapses in that period of time. The last and the least common type of subtype of MS is the primary progressive MS, where there's slow disability progression over time, without any clinical attacks, pretty much from day one. So you just have this slow, steady decline. Patients can be completely mobile, and then over time, they start using a cane to a walker. Eventually, may need even a wheelchair. But we don't really necessarily hear them having attacks or relapses where they go back to baseline, or at least partially back to baseline.
So a lot of times, after people have really learned what MS is and what type of MS, then attention really turns to how do we control it? And a common question is, can MS be managed with diet and exercise?
Yeah, this is a very important and very a good topic to discuss in patients, especially during their initial visits. So not only do we stress on the importance of our MS drugs, our MS, what we call disease-modifying therapies, which Dr. Harrell would cover during his portion of the topic, but lifestyle modifications and just kind of modifying how you live your life is very critical. So, some of the ones we're going to uncover is basically diet, exercise, vitamin D supplementation, smoking cessation. So not only do they help improve the quality of life in patients with multiple sclerosis, but they also not only, help you both physically, but also mood, cognition, and it can also help with fatigue altogether. So let's start from the top: diet. So diet and nutrition is a hot topic in MS. There have been several diet plans that have been suggested in MS, including like the Walls diet, the paleo diet, but really there hasn't really been scientific proven evidence to suggest one is better than the other, or one is more effective than the other. But all in all, the recommendations are to follow, what I would say it's a heart healthy diet. So we do know that cardiovascular risk factors can affect the outcome of your MS. So cardiovascular risk factors being obesity, hypertension, diabetes, if left poorly controlled, can affect your MS and lead to poorer outcomes and lead to more disability in MS. So focusing on a heart healthy diet. Eating food high in fibers, fruits, vegetables, like a, fatty food with more, fish related. And of course, staying away and avoiding processed foods and sugars. All of that's going to be critical for, kind of helping your MS disease course as well. So coming to the exercise portion of it, so exercise, we always encourage exercise. It could be any form of physical activity, even if it's involves just gardening outdoors, if that's something you enjoy, or taking your dog for a walk. But exercise, again, not only helps you physically, but it can also help, fatigue, mood, and also help, the cognitive fog that patients experience as well. Coming to the third point, vitamin D supplementation. A big topic as well, and one of my favorite topics that I discuss with patients. So it's not only, vitamin D is not only a modifiable risk factor in MS, but has also been shown to, be related to MS disease course, MS disease disability. So the lower the vitamin D, the higher the chance, the higher risk of you developing a relapse or, accumulating more disability progression over time as well. And, vitamin D deficiency has shown that, patients with lower vitamin D levels in relapsing MS tend to, have a greater risk for transitioning into a secondary progressive MS as well. So the last part of the topic, again, a very important discussion, is the smoking cessation. Smoking has time and time been, linked to a poorer prognosis in MS, more disability, even from the initial onset of the disease. So it's not only important for your general health, for your cardiovascular health, but also very critical for your overall MS health as well.
Thank you, Natasha. That's really interesting. Lastly, a lot of patients come in with things that they've read online, things that their friends have told them about MS. Are some of these untrue?
Right. So great question. And I think that's always something that comes up towards the end of our discussion. So I like to, label them as the MS myths. So, with the whole social media era these days, and patients, reading up things online and coming across, questionnaires online, and also hearing stories from relatives and kind of outdated information that kind of follow down from generation to generation. And so I always like to kind of go into them in a little more detail and just to kind of clarify things with them. So one of the questions is, will MS kill me? So no, MS will not kill you. You could die with MS, but you would not die with it, but not from the disease. All right. I've been told I cannot become pregnant if I have MS. So this is absolutely wrong. MS, by no means, it does not affect one's fertility. It does not lead to anyone having greater risk for miscarriages or for any birth abnormalities. And in fact, pregnancy, the state of pregnancy is actually protective for MS. So it is usually the changes that happen in the body, the hormone shifts that happen, actually favor, a anti-inflammatory kind of a response, which actually is protective for MS. So the risk for relapses is lower during the period of pregnancy, especially in the second and third trimesters of pregnancy. Will I end up in a wheelchair? So every individual's MS is different. So you cannot compare yourself to what someone else's MS was, even if it was your twin sibling who also had MS. So even with the same genetic makeup, the MS disease course is almost always different between two individuals. So In the current era with MS treatment that we have several drugs that have been proven to be very highly effective in not only preventing relapses in patients, but also in slowing disability progression. So, the rate of patients, ending up in a wheelchair has been significantly, reduced over the years as well. But yes, however, if left untreated, MS is a bad disease. So that's why we, time and time stress on the importance of the, early treatment is better than no treatment. And of course, treatment is better than no treatment. All right. So is exercising safe? So absolutely exercising is safe. It could be any form of exercise, whatever you feel comfortable with, whatever your body allows you to do. It is highly encouraged. Can, definitely, like we just talked about earlier, can improve your quality of life. And it is completely safe. There's no limitations when it comes to exercising for the most part. Will my children get MS? So of course, several you see in clinic, they're usually in childbearing age. They have, plans to become pregnant, plans to start a family, and always worry about, whether their children would get MS or the children they already have, what are their risks for getting MS? So MS is not one of your classic inherited genetic diseases. The risk for an offspring developing MS is actually very rare, probably 1 in 60. And of course, there's other factors that are related to the development of MS in individuals. So other than, just the genetics. So we talk about the environmental factors, which will be discussed later on in the discussion as well, which could include a, geographical location, vitamin D supplementation, viral etiologies, amongst others. So we'll look into that as well. So all of the questions, so all great questions that patients come with, and but for the most part, these ones are just want to make sure that we get clarification to the patients and counsel them about what's myth and what's a fact.
Interesting. Thank you for covering that.
I covered my portion of the talk with the question and answers that Asaf had presented. So we'll kind of take it onto the next level here, and I'm going to ask Asaf a few other questions. So Asaf, so I kind of went over what MS was, how it affects the brain and spinal cord, what the symptoms MS causes. Can you kind of highlight what actually causes MS? So we know what happens in MS, and what this effects of MS, what the immune system does, but what triggers that immune attack? Can you talk to us a little bit about that?
Yeah, absolutely. So this is a very frequently asked question. So the truth is that we don't really quite understand what causes MS, what leads to MS, and it's probably multiple different factors. One of which we know is a genetic predisposition. So MS is not so to speak, a one-to-one sort of hereditary condition, but there is a genetic predisposition that people can inherit. If somebody has a first-degree relative that has MS, their chance of developing MS is about 2 to 5%, depending on the literature. And that is above the general population by a substantial amount, but it's still a very, very low number. In people that, in studies that have looked at identical twins, that risk actually increases substantially to about 20%, but still a relatively low number. And really that's because there are many different genes that are associated with risk for MS. There have been more than 100 risk genes identified. And on the other side of the spectrum, we think about environmental triggers that, for the most part, are poorly understood. And Natasha, you mentioned some of them earlier, but those can be immunologic, microbial, toxic, or environmental causes. And some of them that have been sort of thought about and studied haven't really panned out. And together, both the genetic predisposition and the environmental trigger then sort of work together to cause autoimmunity and resultant demyelination. And so the environmental factors are very, very difficult to study. And one of the thoughts is that MS is caused by what's called molecular mimicry, which is the idea that, well, the immune system is responding to a foreign pathogen, right? And that foreign pathogen may look like myelin, okay, or like parts of the central nervous system, and that causes the immune system to get confused and while it's responding to a foreign pathogen, also attack one's own self. Vitamin D, as Natasha mentioned earlier, it functions in immune regulation, and there's evidence to suggest that people with low vitamin D, which is very common in the Northeast here where we are, actually increases the risk of developing MS and also is associated with increased MS severity. As far as microbial causes, there has been evidence that Epstein-Barr virus is associated with increased risk of MS. Now, it may be a necessary step in the development of MS, but it's certainly not sufficient to cause MS. And the reason why is that about 95% of adults have antibodies to Epstein-Barr virus, or EBV, which causes mononucleosis. So we know that that's not sufficient to, an EBV infection is not sufficient to cause MS, but it may be a necessary step. The reason why that nearly all people with MS are positive for Epstein-Barr virus antibodies if we check their blood. So this association, this relationship is, still remains poorly understood, but it does seem to be a risk factor. There is also a hypothesis that the gut microbiome, which refers to the makeup of the bacteria in our gut. We have normal bacteria that help with digestion. That can be a potential cause for MS. There's a lot of studies looking at that and its relationship with MS. And so this brings back to the point that Natasha, you highlighted, that diet seems to affect MS disease scores. Maybe this manifests its effects through effects on the gut microbiome. But we need further research on that topic. As far as toxic or environmental causes, again, they remain poorly understood. There is some data that maybe air pollutants may be to blame or may increase risk for MS. And there's data that suggests that decreased sun exposure may be a risk factor for MS, and specifically decreased sun exposure during development, so during adolescence or during childhood. And whether that's related to low vitamin D, we get vitamin D from the sun. Whether that is a reason why we see that that increased risk with decreased sun exposure is yet to be understood. This is actually an interesting but old slide. It does show that the farther somebody lives from the equator, the higher the risk of MS. And so people that live in right around the equator have very, very low rates of MS. Now, and the risk seems to be related to where somebody lives during adolescence. So if somebody moves from around the equator when they're very, very young and then grows up as an adolescent in the Northeast, for example, they sort of take on that higher risk of MS that's associated with the Northeast. Whereas if somebody moves from around the equator later on in life, they still exhibit that lower risk of MS. That argues that there's something during development, during adolescence, that's important.
All right, so that was great, Asaf. Thank you for highlighting all those important topics. So really, we don't really know what the cause of MS is, but we do know that there are several risk factors out there that can play a role in MS. So let's talk about MS treatment for a bit. So we know that over the last few years, decades, MS treatment has gone through several advances over the years, but what are some of the limitations of treatment? Could you tell us a little bit about that?
Yes, I'd be happy to. So over the last two decades, the field of MS treatments has really been revolutionized, and there's been really enormous advancements over the last 10, 20 years. So currently, there are 10 different classes of medications. There are over 20 different FDA-approved medications for relapsing MS. And just to give you an idea, prior to 2010, only 3 classes existed, two which were injectable type medications, and one which was an infusion medication. So really, just over the last decade, there's been a substantial expansion in the availability and the options that the people with MS have. And just to give you another idea, which I think is mind blowing, is that the first treatment was just approved less than 30 years ago. And now we have over 20 different medications. So really, there's been a substantial change. All these medications have been proven to lessen the number of new lesions, the number of new relapses, and disability over time. So in addition to how effective our medications are, there's been also tremendous advancements into how tolerable and how safe our medications. Each medication comes with different pros and cons, and that really depends on sort of how these medications work. They all work in different ways. And we've come to the point where some medications that we have available make relapses exceedingly, exceedingly rare. So talked a lot about the advancement. What are the limitations? What can we do better? We have a phrase called the unmet needs, right? I think we've done very, very well in controlling relapsing MS, preventing it from getting worse, but we do need better treatment of progressive MS. There have been modest advancements over the last 5 years, but there's a lot of push in research to develop new treatments. We also need better treatment of MS symptoms. Natasha, you highlighted a lot of the symptoms that people with MS face on a daily basis, and the disease-modifying therapies, the treatments that we have that are FDA approved for MS, by and large, do not affect existing MS symptoms. And so we do need improvements. While we do have some treatments for these types of symptoms, we do need improvements to those treatments with regards to fatigue, pain, muscle stiffness, mobility problems, and also improvements in treatments and honestly access to treatments for mental health issues like depressed mood and anxiety, which are also very, very, very prevalent in this population. And then finally, rather than just stopping, even if we can stop or delay MS worsening, we really want to sort of go further and develop new strategies for reversal of existing neurological disability. So that includes remyelination strategies or neuroprotective strategies. And this is currently being researched. And this is something that just over the last 5-10 years, this has been researched. And if successful, it would be transformative.
All right, so that was great, Asaf. So we've kind of come a long way with MS treatment, and of course, there's a lot of more research down the line. That's exciting news to come with. Another hot topic in MS is stem cell transplant. So I have patients that ask me, should I get stem cell transplant? When should I get stem cell transplant? So what's your approach to that question when patients present that?
Yeah, that is a very common question that people with the first diagnosis, new diagnosis, ask. And I would say most of the time the answer to this is a flat no. And when most people, when they're asking about stem cell treatment, really they're referring to what's called hematopoietic stem cell transplantation, which is a procedure in which stem cells are collected from the body. They're stored. And this is collected prior to depletion of the immune system, and then they're reintroduced, which is sort of, you can think about it as sort of a so-called reboot of the immune system. And it seems to be effective for people who have relapses, continued relapses, despite being on highly effective therapies. But while this is effective for those individuals, this is becoming very rare these days. So somebody that continues to have relapses with the more effective medications nowadays, really becoming a rarity. And with hematopoietic stem cell transplantation, there are upfront risks, namely related to the depletion of the immune system. There are substantial risks associated with that, early on. And where we do have an unmet need is with the treatment of progressive MS, but it's not thought that this is likely to be very effective for people with progressive MS. And the other type of MS or stem cell treatment that's out there and that's currently being studied is what's called mesenchymal stem cell treatments, which really are mostly in early stage clinical trials, and there isn't much definitive data on their efficacy. And there are a variety of different small clinical trials looking at that. So time will tell.
So that was all great information, Asaf. So we kind of addressed the different advances and all the advances that taken place over the last few decades in terms of MS treatment. Can you kind of shine light on what's going on, these days in MS in terms of research, and how would the research that we're doing, today affect things for the future in terms of MS management?
Yeah, so it's a great question. One of the things that attracted me to this field is the change that has happened over the last decade or two, as I mentioned before, and it's certainly not a static field, and the research hasn't stopped. So what the field of MS treatment will look like in 10, 20 years from now, we don't know right now, and there's a lot in the pipeline. So there has been a focus again on treatment of progressive MS, improving the available treatments that we have. There's the National MS Society has a progressive MS alliance that they're supporting, trying to find more effective therapies for progressive MS. And one of the things that's on the horizon is what's referred to as tyrosine kinase inhibitors, BTK inhibitors. They are a new class of treatment that has better penetration into the central nervous system, so passing the blood-brain barrier. And a lot of them are in late phase clinical trials for both relapsing remitting, but also for progressive MS. There's also a treatment being looked at, being studied called ATA 188 that utilizes immune cells, so T cells that are targeting EBV-containing cells in the body. And so this is being looked at in early stages in progressive MS. So we'll see what the data looks like in the future. And then there is Abuelast, which and variety of other different sort of medications in various degrees of various different phases of clinical trials that may improve the treatment for progressive MS. So the field is really moving towards that direction. We've done very, very well controlling relapses. Now we want to prevent progression in progressive MS. Outside of that, as I mentioned before, one of the unmet needs is that we need medications. Really, that would be the holy grail, is medications to reverse existing disability. So repair strategies, and there are several in early clinical trials, several medications that may enhance remyelination, and a couple of them have made it to phase 2. Again, we'll see what the data looks like, but that research is ongoing. And then improvements on existing therapies, really to improve both safety and decrease side effects and improve tolerability.
All right, so that was great. Thank you, Asaf. So, constantly evolving field of MS, and a lot of exciting news and research down the pipeline. And so this is pretty much the end of our discussion, our Q&A for helping you all understanding MS. And, we covered a lot of topics today, from, the introduction of MS, what to expect in MS, what are the common, misconceptions regarding MS as well. And then, we talked about the causes, going into treatments, and of course the current research that's in the current horizon, and where to go from there. So we hope you found this Q&A helpful, and definitely reach out to your MS providers, reach out to your doctors, and making sure that you're getting the appropriate treatment, and whatever other questions you have, definitely reach out to them, and hopefully this will help you with your MS journey.